While the uphill task to curb the spread of COVID-19 continues, the dire need for access to essential health services remain a priority for those suffering from other diseases. Before COVID-19, at a time like this, plans would have already been streamlined for the distribution of filaria pills to persons all across Guyana. However, with the emergency measures currently in place to contain the virus, no such campaign will be rolled out this year. This is according to Deputy Chief Medical Officer Dr. Gordon Boyle, who spoke with Nightly News recently via phone.
Most likely we're going to have to defer it until maybe February next year. It's just that we need a little bit more time to plan it because of the restrictions that COVID-19 placed. Before we were able to use a mass gatherings, bring a lot of people together and distribute. Now you can't use that method because it's against COVID-19 rules. So we got to figure a way now of still being able to reach people and address the COVID-19 restriction.
Dr. Gordon Boyle pointed out that Guyana will still be using the same treatment regimen and that the ministry is working closely with the Pan American Health Organization to come up with a suitable rollout strategy amid the pandemic. During the MDA 2019 campaign, which commenced in October, the World Health Organization advised that all countries with a history of lymphatic filariasis should add a third drug by the name of ivermectin to the diethylcarbamazine and albendazole regimen. During that period, Guyana administered 3 different tablets, ivermectin, DEC, and albendazole, to eligible Guyanese. This combination of 3 pills is called IDA and is touted as being effective in reducing the time needed to eliminate filaria. The aim of the triple drug therapy was to eradicate filaria by 2020. The 3-drug regimen given as a single dose sterilizes adult filarial worms for at least 5 years. Lymphatic filariasis, or filaria as it is more commonly called, affects the body's lymphatic system, which functions to remove unwanted fluids from the body and transports lymph, a fluid which contains white blood cells that help to fight infections. Infection occurs when filarial parasites are transmitted to humans through mosquitoes. Infection is usually acquired in childhood using hidden damage to the lymphatic system. The World Health Organization states that the disease is caused by infection with parasite worms called or classified as filaria worms. According to the Deputy Chief Medical Officer, Guyana, once the campaign is rolled out by March of next year, will be able to qualify for elimination of the disease. TemikaRodney reporting for the HGB Nightly News.